Hello, I'm Shakola.
And I'm Rochelle, and the topic we're presenting is Marasmus.
There are two major types of malnutrition. Protein energy malnutrition has two severe forms, marasmus being one of them.
Not to be confused with kwashiorkor, which is another rare type of malnutrition.
Marasmus was first defined in 1925, a chronic state of malnutrition of a severe grade, originated from the Greek term marasmos.
As shown in the top left corner, there is a man and his son suffering from this disease. The body's systems affected include the integumentary system, which causes brittle hair and nails and also causes skin to become dry.
It also affects the respiratory system because if left untreated, it can cause a respiratory infection.
And the digestive system, which causes diarrhea from the result of dehydration.
It also can affect the lymphatic system. This disease infects your muscles and your tissue.
Lastly, it affects the nervous system. In severe cases, it can impair the cerebral functions in the first year of life.
Marasmus mainly affects children in developing countries or abusive homes. Although common in children, this disease can affect adults as well.
As shown in the map, in the darkest color red, more than 15% are affected by malnutrition. In the middle shade of red, more than 10% are affected by malnutrition, and in the lightest shade of red, about 4% are affected by malnutrition. It was reported that a mother took her 4-year-old son into the hospital where he suddenly had a respiratory arrest. After he was admitted, it was decided that he had severe malnutrition. Afterwards, there was an investigation prompted and a clinical follow-up. This is one of the cases that derives from abusive homes.
The causes of marasmus include anorexia, a lack of protein, developing countries where the food is scarce, when one doesn't ingest enough nutrients, including carbohydrates, having a condition which doesn't allow the body to correctly process nutrients.
Symptoms can include dry skin, dizziness, brittle hair, a respiratory infection, a growth stunt in children, which is the most common, diarrhea, one to be under normal weight due to loss of body fat and muscle tissue, and lack of energy.
Risk for marasmus include loss of muscle, stomach shrinkage, and if left untreated, death.
The pictures shown to the right are people with the disease marasmus.
How someone is diagnosed with marasmus is from weight loss, loss of energy, from an eating disorder, from a physical test, and a body weight reduced below 62%.
Treatments can include one to intake dried skim milk with boiled water, an eating plan done by a registered dietitian, possible antibiotics if infection occurs, and a possible feeding tube if the disease became too severe for the person to intake food orally.
Cost of treatment can vary depending on severity, geographical location, and dietary needs.
Price shown does not include follow-up appointments and mental counseling if needed.
The risk of treatment for marasmus includes nausea. Although a diet is corrected, a child will never reach their full growth potential. Patients with marasmus should be isolated from other patients, especially children with infections. Treatment areas should be as warm as possible, and bathing should be avoided to limit hypothermia. The hospital structure is best adapted for the treatment of severe malnutrition.
The stages of treatment can be the initial phase, which occurs within the first 10 days of treatment with IV treatment or orally, the rehabilitation phase, which occurs 2 to 6 weeks within treatment when the person is eating and no longer malabsorbing, and lastly the follow-up phase where they check up on the child or the individual.